In critical care pharmacy, understanding the dynamics of the intensive care unit is crucial. Pharmacists must swiftly assess patient needs, manage complex medication regimens, and collaborate with the healthcare team. Critical care pharmacy demands expertise in medication management, rapid decision-making, and interdisciplinary collaboration. Pharmacists play a crucial role in optimizing drug therapy, ensuring safety, and improving patient outcomes in the intensive care unit. Pharmacists in the intensive care unit play a crucial role in patient care. They ensure accurate medication reconciliation, optimize antimicrobial use, and adjust dosages for renal impairment. Key admission priorities include assessing patient history and initiating immediate interventions. In sepsis, pharmacists rapidly implement evidence-based actions to stabilize patients, significantly impacting outcomes. Intensive care unit pharmacists play a crucial role in medication reconciliation, ensuring accurate transitions of care. They optimize antimicrobial stewardship by selecting and dosing antibiotics based on cultures. They manage vasopressor and sedation support, adjusting infusions safely. Renal dose adjustments are calculated for patients with kidney dysfunction. Adverse event prevention involves identifying drug interactions and mitigating medication-related complications. Upon ICU admission, assess airway patency and intubation needs. Evaluate respiratory status and oxygenation. Monitor blood pressure and perfusion. Screen for sepsis using quick sequential organ failure assessment. Systemic inflammatory response syndrome criteria and lab values. Obtain cultures before antibiotics when feasible. Confirm intravenous access, ensuring patency and infusion compatibility. Administer antibiotics within 1 hour for septic shock patients. Verify empiric antibiotic choice and dose, considering renal hepatic function, continuous renal replacement therapy dosing, and local resistance patterns. Support resuscitation by managing fluid balance and initiating vasopressors as per protocols. Follow guidelines from the Surviving Sepsis Campaign and World Health Organization 2024. High-alert medications like vasopressors, insulin, anticoagulants, and sedatives demand vigilant monitoring. Verify infusion rates, concentrations, and Y-site compatibilities. Adjust doses for acute kidney injury and continuous renal replacement therapy patients. Conduct thorough medication reconciliation to review home medications and identify discrepancies, ensuring patient safety and optimal therapeutic outcomes. A 62-year-old male presents with fever, hypertension, and tachycardia, indicating septic shock. Verify cultures before administering antibiotics, including blood, urine, and respiratory when possible. Adjust empiric antibiotic doses based on weight and renal function, checking creatinine clearance for accuracy. Review nephrotoxins and anticoagulants for potential complications. Communicate and document the intervention and monitoring plan with the team. Active participation in intensive care unit rounds enhances patient outcomes and medication safety. Advocate for rapid antibiotic administration in sepsis, as every hour is crucial. Reassess continuous renal replacement therapy dosing frequently. Utilize the Richmond Agitation Sedation Scale for consistent monitoring. Comprehensive documentation of interventions supports quality improvement and patient safety.